Calibration ensures that the measurement accuracy of any audiometer meets a known audiometric standard, namely ISO 389. Calibration is the process of comparing an unknown output value with a known output value. Once we have the unknown value, we can then make adjustments to ensure that the unknown value becomes a known value and meets the actual audiometric standards. Calibration for an audiometer is the audiometer plus the headset, and it's really important that these two items are actually kept together because they are a matched pair. If we change either one of those, we then have to do a complete calibration again. So once the calibration has been completed, a calibration certificate or certificate of calibration will actually be issued for that specific audiometer and headset. The key point on a calibration certificate is the actual title says calibration certificate or certificate of calibration. Secondly, it has to identify with ISO 389. Thirdly, the actual serial number of the audiometer is listed, as are the two serial numbers for the earphone transducers. Then, it sounds obvious, but we actually need a date of calibration on the certificate. And finally, with a calibration certificate, we normally have before and after adjustments, so everyone can actually see the value of calibrations and that they actually meet those particular standards. Well, calibration is very important because the audiometric test records that we create from the tests themselves are actually a legal document in terms of they can be used in a medical legal case. Failure to update the actual calibration routine within a PC-based audiometer and instead just purely opting for a verification has the unintended consequence that the calibration date held within the audiometer software will be wrong. Therefore, every record you do for the next year will have the original calibration date in, not the new calibration date. In these circumstances, the audiometric test record has to be kept for 40 plus years because there is potential for future compensation claims, particularly noise-induced hearing losses. If the employer cannot produce a valid calibration certificate, again going back 40 plus years to the relevant time period of the claim, it casts doubt on the whole validity of the test program. In a medical legal setting, the test results very much are aligned with the calibration certificates. If the calibration certificate is not true or accurate, then the whole case may be dismissed. So referrals to occupational health physicians, referrals to GPs. If there are inaccurate test results recorded, it requires second or third additional tests. So if we look at safe, effective, quality occupational health services, CCOSH, CCOSH is awarded to those organisations who have actually met the audit standards from this organisation. Calibration certificates are a key part of this audit process. Amplivox provide a complete and comprehensive service. So whether you require a return to base type activity, or we're happy to actually send our engineers on site such that we can provide on-site calibration services, which is going to very much minimize any instrument downtime. For further information, can you please contact Amplivox via the website or email address. Thank you.